When I think about healthy children, I think about writing a name for the first time in a crayon on a piece of paper. I think about riding a bicycle with no training wheels and the wind in their hair. I should not think that the number one cause of death for a child in our country is a firearm. When the ripple of a bullet passing through the air impacts a child, that ripple effect goes on and on and on. It affects who saw that child being shot. And what's the ripple in that community, in that household, in that neighborhood? Then the ambulance crew that brings the child to the hospital, what's the impact on them? Now you bring in 30 to 40 trauma surgeons, nurses, staff. That ripple effect, when you really think about it, it touches all of us. I get caught in a gap in time. Time literally stops. I know in the operating room that their child has died. The parents waiting outside do not. And I'm about to cross a time divide where their life will go from a life they knew to a whole new empty existence. And that walk down the hallway, it's one of the loneliest walks you can take. There are no words to say. The best I can offer is my presence, that they don't suffer alone, and we suffer this with them. And I leave it there. And then the rest is really in God's hands. A story that comes to my mind is the story of Nazir.
Me, my cousin, my friend, we just went to a party. It was just a chill party. Just DJ playing music, everybody outside. That's it. Much, but all I heard was a pop, 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 and I thought it was fireworks. And then my cousin told me to pull my arm up, and then he realized I got some. The dreams would be just the whole thing replayed all over again. Just me seeing it, me reliving it.
This was a moment in his life that the trajectory of that bullet could lead to a change in the trajectory of his life. Since then, he has worked with our violence interruption team, with a community organization called Snugs that we have partnered with. I see right now Nazir on the path to making a difference in his life. Part of my job is to love your children as much as my children. I know and feel the tremendous weight of that responsibility. I want all of us to feel that weight for each other's children when we talk about firearms. We as humans have the ability to come around what's best for our children. We agree so much more than we disagree. It is a collective effort, and together we can make it better. And we will make it better.
You know, Nazir used the word dream, but not in a positive context. And when I think about children, and I think about what we do at Children's Hospital, part of the responsibility, that weight, is all of the dreams that that child has in their future, and that the parents bring when they bring their child to us at a place like Cohen Children's and at all of your places around the country. That weight of that dream, that potential, that future, it's there. You feel it, you know it. And I have that dream at home in my own life. My parents were exiles from Cuba. I grew up across the water in Queens. I could see Elmhurst Hospital from the window of our apartment with my brothers. And they had a dream. They came here with the dream that parents have, that life will be better for their children, that the world will be better for their children, and that they will do everything they can for that. And for me, that dream became to become a doctor. And that dream eventually was, and I'm sorry to all the non-surgeons, was to become a surgeon. And I thought that I would work in that space, helping to do complicated things for little babies that were born with problems. And I thought maybe if I did research in a lab, I could help find a molecule that could change necrotizing enterocolitis, this devastating problem for premature children. And yes, I've had a chance to do that kind of work, but I've only separated one set of conjoined twins at our children's hospital. I have cared for many children who have been injured by firearms. And that's where the work needed to be done. And I'm so grateful to Mr. Dowling and to the Northwell team that allowed frontline people like myself to support the work that has been built through our Center for Gun Violence Prevention. And that work has changed how we care for children now compared to when I first got here. It includes the research that Dr. Kapoor and Dr. Sathya lead that was funded by the NIH when the NIH funded those kinds of events, that kind of work. It includes the learning collaborative that we learned so much from so many of you that are here, that have shared and that have collaborated with us. That is the space that has led to building up a tremendous team that I want to recognize that are here, of the hospital responders who help to connect patients then with community organizations like SNUG who are also here, so that when we have someone as special as Nazir with the dream that changed that day, how do we get them back on track? The dreams are the right dreams. And I want to recognize all those folks that are here, and I'd ask them to stand up if they're not already standing, and I'd like Nazir to stand up as well to be recognized for what you've done. And Nazir, you have a room full of people who are so rooting for you. There's a microphone somewhere behind you, I think, or on the floor. What, do you have something you'd like to say to this room of people? You got it.
I just want to say thank you, and
That's perfect.
I don't.
That's perfect. That takes tremendous courage for a teenager in a room. I'm so proud of you for being here, and for so many of you for being here. This is not easy, and in so many ways, so many of you, including Nazir, are living proof for why we're here and why this is so important that we get together and we find the path forward together. And we heard about headwinds and tailwinds. I think we're ready for our next panel to try to think a little bit about what that looks like. And at the risk of trying to change the mood a little bit in this transition, I'm reminded of one of my senior colleagues who was a surgeon in Washington, D.C. when President Reagan and Mr. Brady were shot many years ago. And when President Reagan was brought into, and many of you may know this story, he was brought into the OR area, and he looked up at the surgeon and said, I hope you're a good Republican. And the surgeon immediately said, today, sir, we are all Americans. And they went to work. And we need to go to work. So with that, I'd like to introduce our next panel to come up, Governor Chris Christie,